Patients will often present to an otolaryngologist office in consultation for sinus surgery, and we determine whether or not there's a need for sinus surgery based on multiple factors. A thorough history is taken to find out how many infections a patient's had over how many years. So usually a patient that ends up needing sinus surgery has had multiple chronic recurrent sinus infections. There may be other factors involved, such as failed courses of medications. Usually patients that end up needing sinus surgery have tried multiple different rounds of antibiotics, multiple different rounds of steroid therapies, multiple different nasal sprays, saline irrigation. So they've tried a lot of things, and eventually those treatments have failed time after time. So when patients come into my office and they eventually choose sinus surgery, it's simply because they're sick of being sick. I ask that question a lot in my office. Are you sick of being sick? If that answer is yes, then let's talk about whether or not there could be a procedure to help you. So we choose patients for sinus surgery based on a couple of things. One is their endoscopic exam abnormal? So when a patient comes in for evaluation in our office, we'll decongest their nose with a topical spray. We'll give them a little topical lidocaine just to numb their nose up so that they don't feel us looking in their nose. And we'll pass a small flexible endoscope through the nasal cavities and examine the problematic areas. If there's tissue swelling or polyps or anything else that's abnormal that's seen, we'll counsel the patient about that finding. If we see those things, we're often going to order a CT scan. A sinus CT scan gives us invaluable information about the extent of the disease. Are there other things involved? Are there hidden polyps? Is there infection in and around the sinus bone? So the sinus CT is a common tool that we use to diagnose sinus disease in patients and choose patients for sinus surgery.